vet panel today consists of Dr. Sarah Hummel from Desert Trails Veterinary Clinic in Winnemucca, Joe Gillespie from Boehringer Ingelheim in McCook, Nebraska, and Lyle Whitaker from Lahontan Valley Veterinary Clinic in Fallon. And so the way that we will operate here this morning is the vet panel. Each member of the vet panel will get 10, 15 minutes or so for their featured topic. Is Dr. Hummel will be first, and we'll just kind of go down the list there, and I'll turn it over to you. You have the floor. Dr. Hummel, and you can speak and we can hear you. So.
All right. Hello, I'm Dr. Hummel, and I am actually at the Ranch Veterinary Clinic. So that's my practice name, in Winnemucca, Nevada, so northern Nevada. And I was going to do a quick talk because we're entering the season of obstetrics, or OBs, dystocias, pulling calves, whatever you want to call it. And I got a harsh reminder of that yesterday. I got to spend most of my day trying to get a calf out of a very beautiful Hereford heifer. So I'm coming from a little bit of a unique perspective. I can't call myself an expert because I am practicing in a time in veterinary medicine where the EPDs for calving ease are such that I don't pull a lot of calves. So every time I get that phone call, I do get a little nervous. So I got a bit of a unique perspective in that I needed to figure out how to get the job done with my limitations of not having the experience. Let's see, and I'm just going to talk about two main features, two main tips and tricks that I use in order to give myself the ability to reposition the calf. I'm not going to talk about repositioning the calf because I think that's maybe not common knowledge, but it's easy knowledge to find. And I find myself in a place where I know what I'm supposed to do. It's actually getting it done that I have the difficult time with. So the first thing I want to talk about are epidurals. Epidurals are incredibly easy. I know I poke a lot of things. I'm very comfortable with needles, but I showed my husband how to do an epidural, and he's never looked back. He can do them. He cannot do them for a couple years and go back and do them. They're easy, and what they do is they reduce the straining. They don't take it away completely, but they reduce the straining. They save your arm. They decrease the risk of damage to the dam because you're not fighting her so bad, and everything's more comfortable. It works great. I don't know if I ever do a calving or any prolapse without doing an epidural. I don't care what's going on. I generally just start with an epidural. All you need is an 18 gauge needle, an 1.5 inch 18 gauge needle, and some lidocaine. Lidocaine's incredibly cheap, though this year's unique because it's been on back order. So we're kind of guarding it, the veterinary industry. But if you have some on hand, I know a lot of people do. You can do a very basic prep. I often don't prep anything, but if you want to, you can shave. I never shave. I might dab it with alcohol and call her a day, but the take home point is this is easy and you shouldn't overthink this procedure. You can also do a hanging drop test where you insert the needle into the skin and then you put some lidocaine. You fill up the hub of the needle, and then you advance the needle, and when that lidocaine gets sucked into it, you know you're in the epidural space. You can do that. You're welcome to. If you go into the epidural space and then come out, you'll lose that negative pressure, so it makes that test, it doesn't work anymore. So I feel like a lot of people get hung up with that aspect, the hanging drop test, when in reality, you've got several spaces that you can go in. You should ideally go in the middle space, but let's say you get one space ahead or one space behind. I wouldn't get caught up on that either. Just lift that tail, jack that tail up and down, and try and feel the indentations. They're easy in a skinnier cow if you have a fat heifer, then it's a little more difficult, but still easy to do. Otherwise, just make sure the needle is center on the cow. When you first go in, chances are you're going to hit bone. So you're going to hit there or you're going to hit there. So the bone ahead, the vertebrae ahead or behind. So then you just start walking your needle and it's going to fall into that epidural space, and you'll know it's a very telltale feeling. It'll fall into the epidural space, and then you can slowly give the lidocaine. So I just want to encourage more people to try this, because my producers especially live an hour and a half away. They don't necessarily want to pay for an emergency call. They're capable of doing this, but sometimes it's nice to have a little help, save your arm, and like I said, prevent the dam from getting hurt. So there's an excellent video. I put the link to the video in the notes, and if you want a visual effect, I thought that would be the best use of your time, is just look up that video. Again, they go into a lot more prep than I do as far as clipping and scrubbing and alcohol. Don't get bogged down with the details, just try it. The worst case scenario, let's say you miss completely. No big deal. Lidocaine's not going to do anything. If you get it outside the epidural space, you're going to be exactly where you started, and you can either give up from frustration or you can try again. The other thing is, if you go too far ahead, so if you go into this first space, you might get a cow that wants to lay down on her hind end, and she might take longer getting up. This isn't going to kill the cow. It might cause some frustration, but it's not the end of the world. If you get it too far back, you're just going to get less of an effect. So the take-home point with epidurals is it's easy. If you totally botch the procedure, you're not going to do any harm. You're not going to be out any money. It's going to be fine. So whether you have a dystocia or a prolapse, try an epidural. They're very easy. All right, we went through the consequences, and again, this will save your arm for those difficult calvings, for those breech calves or those headbacks, or if you have to do a fetotomy, which we'll talk about later briefly, but epidurals. Okay, so the second tip that I use almost on every single calving anymore, and as well as horse work, is epinephrine. So epinephrine is used as an emergency drug, typically, if you've heard about it. Adrenaline's another name for it. If you're allergic to bees and you carry around a little pin, that's an EpiPen, so that's epinephrine. So it's not a harmless drug. It has the potential to cause heart effects. I've never had that happen. Again, the potential is out there, but I never stray away from using it, because it really causes a profound relaxation of the uterus. You can give it in the vein or you can give it in the muscle. If you give it in the vein, you want to give 5 to 6 mils. And if you give it in the vein, you want to start right away with what you're doing, because it's going to happen like that, and you might have 10 to 15 minutes to work. If you give it in the muscle, you have a little bit longer onset, but you still only have 15 minutes to use the effect of epinephrine. So have a really good plan prior to starting it. I'm getting over a cold, so I'm trying not to cough. So epinephrine is another incredibly cheap drug. You can ask your veterinarian about it. I think it's going to be up to the discretion of the vet. I trust a lot of my producers to have it on hand, not just for anaphylactic reactions to vaccines, but also for obstetric work. But you will have to get all of these drugs through your veterinarian, and they can talk to you more about the pros and cons of using it. But if you can get your hands on it, like I said, in the veterinary world, it's a cheap drug. In the human world, it's a different story. So those are my 2 take homes. Get your medical box ready, because it started. So epinephrine, if you can get it, lidocaine, if you can get it. Oxytocin is another great one to have, and I use that after I got the cap out to contract that uterus right away. stop any bleeding if it's occurring, or at least slow it down, and also help the cow cleanse a little better. Dexamethasone I use very often, especially if it's a hard pull, just because I don't want to deal with a down cow. The worst thing than a dystocia is a down cow. So I routinely give dexamethasone, sometimes a high dose. My high dose is 20 mils. Other veterinarians will use much higher doses, but I like to stop at 20 mils. And then also, if it's a tough pull of a calf, a lot of times you're getting a lot of contamination in that uterus. My go-to drug is Exceed. We can ask Dr. Whitaker his opinion on that, but I like Exceed for uterine infections. Uterine boluses get brought up a lot. I'm not a fan. I don't think they do any harm, but I think there's enough studies out there to show that they don't do enough good for me to use them. But if a producer wants to use them, I have no problem with that. So that's your drug box to get ready. Other things is I prefer a calf jack. I think some people like come along, some people like straps. I have the best luck with the calf jack, and I also think I can do better maneuvering with it. And you can never have enough lube. This actually came from Dr. Whitaker, but I will take a stomach pump that I use for equine colics and pump a gallon of lube into that uterus in certain situations where I need to be able to pull that calf a little easier. And then I wasn't going to talk about fetotomies. That is a procedure where the calf is dead. Rule of thumb is that calf is dead. I do not do it if you have any doubt whether or not that calf is alive. It's cutting the calf out of the uterus piece by piece. We do it all the time. And again, yesterday when I was on that call, I was talking to the producer, and he knows how to do them. He's comfortable doing them. So if you want to learn, I recommend talking to your vet about it. There's some finesse to it because you don't want to hurt the dam. And again, you want to make sure that calf is dead before you do it. But the easiest way to do a fetotomy, rather than worrying about the OB wire, in the front legs especially, is you just cut the skin around the leg above where your chain is, and then you can calf jack that leg out or pull that leg out, and it'll release at the shoulder. So if you have, yesterday I dealt with a head back dead calf, and I ended up having to do a fetotomy. So in an emergency situation, if you can't get a hold of a veterinarian and you know how to do a fetotomy, and you can do it without ripping up the dam, it's a really, really useful tool. Some veterinarians, Dr. Zimmerman was a whiz with his OB wire and fetotomy. I've never learned because, again, Dr. Whitaker showed me how to do it's called a sub-Q skin fetotomy, and I've done that and I've never looked back. So if you're interested in that, I do encourage you to talk to your veterinarian about it. I'm not going to show any images because it's pretty gruesome. All right, where are we time-wise? 11:44. So that's all I have on obstetrics, and I'm at 15 minutes, so I think I'm going to stop there.